Thank you very much. I'm Ryan Sysko. I'm the CEO and one of the co-founders of WellDoc. We founded the company a little over 8 years ago, and I founded the company with my sister, who's an endocrinologist. And as she was practicing at the Joslin Center for Diabetes at the University of Maryland, she really quickly began to understand that there were significant challenges that both patients and providers faced in managing diabetes. And from a patient perspective, I'm sure all of you see this, and it really kind of follows up nicely with Dr. Kavita and this whole issue of self-care. She really felt that patients spend the vast majority of time on their own, self-managing their disease. And with the few office visits she had a year, the analogy that she always used to use is that trying to teach a patient how to manage their diabetes was like trying to teach them a foreign language in 4 15-minute office visits. It just wasn't going to work. They were going to have to make decisions on their own about their medications, their lifestyle, how they were eating that were going to impact their disease. And then secondly, as a trained endocrinologist, she often found that when her type 2 patients brought data in, which was not the vast majority of the time, it was often more of an art than a science, flipping through 12 to 15 pages of chicken scratch and trying to pick out the relevant trends or patterns. And so the thought was, the big aha for her was in 2004, every patient walked into her clinic with a cell phone. And how could she leverage that as a tool to extend her clinical voice and coach patients outside of the office, capture data from them, analyze it, and then give it to a clinician in a very simple way that tells them, here's your patient, here's what you see, here's what you might want to try next. And that was really the hypothesis of WellDoc and how we got started. Just a quick overview of the product. As I mentioned, it really was designed to help support both patients and providers. And from a patient perspective, it is a mobile application that goes on a cell phone. It works on smartphones and feature phones. We started way before the iPhone and Android existed, so we've been working on Java phones. We support close to 80% of the handsets that are embedded in the US today. We've worked in Medicaid populations with great success. And the thought is that and one of the things that Dr. Kavita also said that we believe is really important is that these things have to be personalized and contextual and tailored to individuals. So the algorithms that we put on a patient's phone actually change based upon their medication regimen, based on their psychosocial profile, based upon their comorbidities. We're actually building a specific application for a patient that can change over time as we continue to learn about them. These messages are stored locally on the phone, so it doesn't matter if they travel, doesn't mean if they don't have cell coverage, they can always follow their physician's instructions and get access to our feedback. As I said, we then take that data and send it to our server where we'll analyze it for trends or patterns. What are we seeing? Are they taking their medications the right way? The amazing thing that I always say is that self-management data largely doesn't exist in healthcare today. When your patients walk outside of the 4 walls of your hospital, you really have no clue about how they're testing their blood sugar, how they're taking their medications. And the thing that we always say is it's not just about objective data. It's not just that simple. There's all of the subjective that we have to take into consideration as well. How are patients feeling? So in our clinical study, almost 30% of our patients had depression as a comorbidity. Obviously, untreated depression is probably going to lead to somebody not actually optimizing their diabetes care. So we need to really create the entire picture about the patient and what's going on with them. We then send all that data to the healthcare provider. Today, we largely do that via fax. So once a quarter, the physician will get a consult note with the patient's data and information. We have started to do EMR integration. So we have a program that was funded by the Air Force. We're at GW University. As they use their Allscripts EMR, all of WellDoc's data and analysis is available in the EMR to the physician. As they make changes, let's say to the patient's medication, it automatically updates our algorithms on the patient's application. So the patient and the doctor stay seamlessly in sync via the EMR. And we certainly see that as the future. So with that, I'm just going to do a quick demo. So there's all sorts of ways to get data into the phone, and I'm just going to show you a simple transaction. The simplest form, which I'm going to show you, is just a patient testing on their blood glucose meter and then typing in, using the keypad to type in their information. We have done some integration, which we'll be announcing a little later this year, with Bluetooth meters, with meters that could plug into, let's say, an iPhone, and we're looking at other form factors. The thought is, how do we very simply capture data from patients to feed the engine? Because at the end of the day, we need patients to use this. If they don't use it, it's of no value. So as they come in, the system knows it's the morning time. It's going to tell me it's suggested it's before breakfast. I could change that if I wanted to, but let's say I test my blood sugar and my blood sugar is 200. It's going to tell me this is good information. Well, we all know this is high. We have a team of behaviorists. Patients don't want to know all the time that they're just high. We're going to tell Bill, let's make this great. Let's check back in after your breakfast in 2 hours and see how your food has impacted you. As I come into the system, it will have all of my physician's prescribed medications to me. This is one of the things that we capture from physicians on the prescription form so that I know I'm supposed to take 2 pills of Actos Plus Med at breakfast. You see the Lantus is red. We can support different insulin titration algorithms so that my fasting sugar is 200 today. The system's going to tell me, Bill, don't forget that your dose is going to increase to 30 units. I can also record if I'm on injectables, where I'm injecting. We can do things like add notes. So if I ate at a restaurant and I had a high postprandial blood sugar, maybe I get a message on how to make good food choices at restaurants. So all of this is then sent in real time to our servers and analyzed. And so an example of a longitudinal message might be that, you saw I didn't take my insulin. We're going to say, Bill, it looks like you didn't follow your physician's instructions. Maybe watch this short video on Lantus and why it's important for you. And we have a partnership with some content providers where we can get access to this information. So we actually know what type of phone a patient has, and we can deliver multimedia if they have an iPhone or an Android phone versus just text messages if they have a simple feature phone. When we did our clinical study, which I'll talk about in a second, we went back and interviewed patients and doctors about the system. How did it work? Did it fit into their practice? Did it fit into their life? And so here's just 2 videos of patients and providers.
Really, the phone actually defines your diabetes. I know it sounds crazy, but it actually focuses on, I have this disease, I have this problem. You can't get away from it then because you're looking at it all the time and you're always, thinking I gotta, make sure I take my sugar, put it in there, and, so you're always focused on taking care of your body.
The cell phone, it kind of gave me my life back, really, because before they keep increasing the medicine, that's what doctors do. They try to get it under control. But this way, they looked at everything.
It may be already what I would have done, but, I love other people's input. Well, of course, it would be my decision, but, they say start rapid-acting insulin. I wouldn't just automatically do that, but this is really helpful because, when you're going so fast in a 15-minute office visit, you try to think of everything, but they dump so many other problems on you while they're not just here for their diabetes. They want to talk about their fingernails and they want to talk about what's this bump, and things can be forgotten. And we try our best, but something like this is such a good backup.
One of the things that we've done is really spend a lot of the last few years building the clinical evidence. So we recently had a study published in Diabetes Care. It was a 12-month RCT, 163 patients, 35 physician practices in and around Baltimore, Maryland. We achieved almost a 2-point reduction in A1C, a statistically significant delta of almost 1.2 points between control and intervention. And one of the biggest challenges is people will talk about today is when you think about mobile health, it's not really a technology challenge. It's really how do we fit this into healthcare? How do we fit into the regulatory environment? So our product, it took us 3.5 years, but we got it cleared by the FDA as a Class 2 medical device. How do we fit into the payment environment? Well, our product now is reimbursed. We have a relationship with Rite Aid. We will be promoting this directly to providers under third-party insurance coverage reimbursement. So as a physician writes a prescription, it will go into Rite Aid specialty and to the retail pharmacy as well, where they will do the claims adjudication and benefits investigation to make sure that a patient is covered. And then once a patient starts to use a product, WellDoc will get paid for it by the PBM or the health plan, just as they would for any other drug or device. So these are some of the challenges that we've really had to work hard. Regulatory, building the clinical evidence, building the commercial model, and then really figuring out a way, how do we fit this into patients and providers' lives? So I've been given the 30-second sign, so thank you very much for your time today. to patients.